Welcome back to Orientation Abroad. We're going to talk about health and safety. There are some things you should think about related to health. So, when you're studying abroad, you're there for a whole semester, you want to know what your resources and options are. Likely on site through your program provider or university, there may be healthcare resources available to you. So, reach out to your program. They may even have already sent you information about this, about clinics that are around, how you access healthcare, that kind of thing. You also want to research local conditions that may impact your existing health issues, or maybe ones you don't even know you have. So things like allergies may come up in a new place, amount of sunlight and seasonal affective disorder if you're in the Arctic region, maybe even things like air quality if you have asthma. These things might come up, and so it's just important to start thinking about them. You might also want to plan a method to stay in touch with healthcare providers if you have ongoing healthcare issues that need treatment, or you may even need to locate a local physician and facilitate the interaction between those two. If you have medication that you're going to need to take the whole time while you're studying abroad, you want to review how you're going to transport that to your host country. Just because medication is legal in the US does not mean it's legal somewhere else. Or availability or cost might differ a lot. So please plan on bringing a full supply of any medications that you need to be healthy with you. Remember that controlled substances may be difficult or even impossible to take to certain places. So please, if you're worried about it, contact your program provider as soon as you can, or visit the CDC's website, Traveling with Medication. They have a lot of tips and information on common medications. If you have any accommodations through the Goldman Center for Student Accessibility, please report that as soon as you can to OSA so that we can advocate for you, as well as to your program. Just know that the ADA, Americans with Disabilities Act, only exists in the United States. So the legal protections are a bit limited here. We will do our best to work with your program, and the earlier you get this information to us, as well as to professors, the more likely you are to have your needs actually met. We want to make sure that you're able to succeed while you're studying abroad, and this is part of it. Reach out to Goldman Center if you need an official letter of accommodations, or if you need to rework your existing accommodations for study abroad. And please let your program know if you have any dietary or lifestyle concerns that might impact your study abroad experience. So take a sec, think about what your needs are, and we can help you get there. As far as insurance goes, you do have to have international and domestic insurance while you're studying abroad. The reason for this, you want to be able to access medical care while you are in country. But if for some reason you have to come back to the United States in the middle of your program, something happens, you want to make sure that you can also access medical care when you return. We don't want you in a situation where you have no insurance. So there's options for coverage. If you have the Tulane sponsored health insurance plan, T-SHIP, that'll cover you at Tulane and abroad in the majority of countries. Certain countries like Australia or Spain may have higher requirements for their insurance, and you may need to get insurance through your program. There's also a additional stopgap insurance that can increase your coverage a little bit through GeoBlue. When there are purchase instructions online, you can use the Tulane school code to enroll in that one. This is generally about $300 to $400 per semester and will cover you for the whole time you're abroad. Alternatively, if you have insurance on your own or through your parents, you can contact them to see about adding on international coverage. Though it is important to note, you do have to complete your annual health insurance waiver if you're not enrolling in T-SHIP. That still applies. If you have questions about that, the Campus Health website has a lot of resources for you about health insurance requirements, and this is where you can go as well if you need to opt out of T-SHIP. So we are still going through this COVID-19 pandemic. Things are changing a lot and have in the past few years. We do recommend you get your most up-to-date booster dose, but a lot of the requirements about vaccinations, masking are a lot looser. This is going to depend on where you're going. So some program locations have stricter rules than others, or maybe higher case numbers, and so require additional precautions. But in most cases, we're not seeing programs being canceled outright due to COVID. Before you go, there's a couple things that you want to do. So our office will enroll you with Crisis 24. This comes for free of charge when you're enrolling in your flights and purchasing those through our World Travel Service. What this does is if you need to be evacuated, there's a natural disaster, political unrest, whatever it may be, Crisis 24 is able to contact you and get you out safely of the country. Travel.state.gov has lots of information about your destination, and it's a good place to start when you're researching what conditions are like health and safety wise in your host country. I would also recommend enrolling in STEP. This is Smart Traveler Enrollment Program. This is through the US Department of State. This is basically registering your trip through whatever local embassy is nearest to you. That way, if there is an emergency, they can provide you additional information options for you through the US Embassy, as well as contact your loved ones if something happens. And I would also recommend printing copies of your health insurance information, as well as your passport. Keeping those copies available and on you in physical and digital form, just in case you need them. As always, email our office or your study abroad advisor if anything comes up for you, or make an appointment online. All right, until the next time, see ya.